she takes statins, meaning that her cholesterol's up. Well, why would your cholesterol be up? Would that go with kidney weakness? Absolutely. Now, why is that? Why, when you see kidney and adrenal weakness, would you see cholesterol problems? Twofold. One, backs up the lymph system and creates acidosis, their word inflammation. Okay, so obviously cholesterol is the body's main antacid. You see it in the fluids, in the lymph fluids. You see it in the cell wall, phospholipids. You see it in adrenal steroids. When the adrenals are down, your corticosteroids are down, you're going to see the additional use of cholesterol. Whenever you see weaker adrenals in someone, you start to see the cholesterol plaquing more. It just goes hand in hand with that whole process of acidosis, not removing cellular waste or acids, etc., etc., etc. Statins won't do anything but hurt her liver. Well documented by medical doctors. I'm not the one who's saying this. Deepak Chopra said that. Dr. Weil said that. And I concur 2,000% with that. Just controlling blood serum cholesterol levels, meaning you're suppressing the liver's ability to make it. You never suppress the liver. Oh, God. And yet doesn't stop it from doing its job, meaning plaquing or being used as an antacid. That's why it's ineffective. You'll still stroke and heart attack. I mean, this is part of the illusion of that field, full of illusion. Just remember, cholesterol is a lipid designed for steroid use, for interstitial fluid use, and of course HDL is used with phospholipids in the cell wall. Cholesterol is used as an antacid. You can use the word anti-inflammatory, if you will, but an antacid. And this, of course, is produced by the liver. Deepak Chopra, Dr. Wild, many great medical doctors, I'll say, have commented on that. I've referred to a letter that I think 4 or 5 medical doctors wrote. I've got it in these piles somewhere. Wrote about the statins and how it's ridiculous to think that when you look at blood serum cholesterol levels, that also is related to what's going on in the lymph system. And it is far from accurate. Your blood serum cholesterol levels can be fine and go down with a stroke or heart attack. And that's what you just got to learn, is that this has to do with an entirely different system, and that cholesterol actually plaques in the lymphatic system. It has no reason to plaque in the vascular system because the vascular system is base chemistry. It's kind of like if you have pain in your shoulder and your medical doctor says, well, I can take care of that. I can give you a shot of cortisol or cortisone. Then my next question is, why isn't my adrenal glands taking care of this pain? If cortisol will take care of this, I produce cortisol. How come that isn't happening? And it's simple to understand. And that's when you can link the adrenal failure to all these problems. And then when you understand they sit on top of the kidneys are eliminative organs of what? Why would you be peeing? Why would you be sweating? What is the role of elimination in one's health? And this is essential that the medical community learn this, because most medications, except for I think Mucinex now, are suppressive instead of expectorants. And this is why you see so many escalations of symptoms. And when you try to suppress chronic levels, it just gets worse. So you see what we're up against is real bad stuff here.
You had mentioned this earlier with the cholesterol, but I've got a lot of clients that come in, their cholesterol numbers on their blood work are normal. But you look in their eyes, the cholesterol ring that starts, the plaquing that you see, and it's because of the acids.
Exactly. Can I see what a cholesterol ring in eye looks like? This is Kim. Well, let me just hang on right here. Let me show Kim what a cholesterol ring looks like in the eye. Excuse me just for a minute, guys. How's your trip been down here? Had fun?
Yeah, that's pretty good.
Have fun in the school?
The school was amazing.
The school was fun, wasn't it?
The school was too. Yeah. That's why I'm still around.
Yeah.
I left.
I think this class was buzzing pretty good.
Oh, it was nice.
Yeah. We had a lot of fun.
It.
Yeah. Let me show her our cholesterol ring here. Oh, I know. I tell you, I got so much of this in here. These are my cards. You know what would be hell, wouldn't it? Pick one, and that was your life.
Oh, I got a good one.
Oh, not bad. You got sulfur, you got nerve rings, you got a lot of lip.
I can deal with that.
Oh, all right, so I want to show you this. See this white translucent ring around the eye? That's a cholesterol ring. Now look at this eye. This eye is all orange, sulfur, heavy, heavy sulfur use. And you see this white translucent ring. It generally starts up here, and we call it arcus senilis. And then it starts to invade the body, because the more acid you become with weak adrenals, your body going to start using cholesterol to fight this. It's going to be oh yeah, I got all kinds of pictures from years and years. I mean, look at that one. You know, some real nastiness in there. So that's what it looks like, Kim. So when your cholesterol is up, warning, warning, adrenal glands are going down. You're too acidic. Start pulling on get those adrenals up, get your kidneys filtering, pull these acids out, and your cholesterol will go down just as beautiful as your plate, because it's not meant to hurt you, it's meant to help you. However, you're supposed to be fixing what's going on here. But no one's telling anybody, because they don't know. The level of consciousness on this planet is still a little low. So it's not awakened yet to some of these realities. And that's what I love about each and every one of you beautiful, beautiful souls that I'm honored to work with here. Because you guys get it. You're out teaching it. You're out working it. And I think we're going to have an incredible...
And they're starting to live it and
yeah,
experience it.
baby.